Good morning, students.
Good morning, sir.
Yes,
Good
in
morning,
begin.
sir.
Yes, study of social process. We had been learned that every types of social processes, which we have been experiencing everyday life. Next, social process in hospitals. Measurement of social process in hospital is essential to evaluating the hospital services. As we had been learned the role of cooperation in the hospital. Today we have to start with role of competition in hospitals. First role, competitiveness among the healthcare professionals, among the doctors, nurses, between doctors and nurses, and other allied health professionals. Then care promotion, client-oriented care, competitiveness, caregiving. Then treatment, efficient treatment provide to client. Then responsibilities. Competitiveness can make more responsibilities and stimulate the healthcare professionals. Then increase socialization, learn with each other, enhance self-esteem, self-confidence, development of accurate nursing skills, and help to professional judgment and decision making. Look at this. The healthcare professional compete with each other to attaining the goals. The role of conflict in hospital. Every hospital having conflict between healthcare professionals and management and healthcare professionals is essential for first is that strengthen the confidence in practice. Then promote health, the team spirit. Team spirit. Next is that improvement of groups participation. Then understand of values, hospital services, working out of good relationship, clear out relative status between the healthcare professionals. Then harmonious relationship. Through conflict, identify the issues and make more harmonious and cooperation. Then help to define issues. Through conflict only, we can identify what are the real issues are there. The resolution of the problems in the caregiving area. Then attentiveness. Small conflict help to the every healthcare professional more attent on their professional activities. Look at this picture. Competitive care. Role of accommodation in hospital. First, prevent role conflict. Next, communication, improvement, Then resolution of conflict and formulate conflict resolution strategies in the hospitals. Then improve the team performance in every sections of the hospital. Then resolution of conflict by means of various methods adopting tolerance, conciliation, conversion, rationalization, arbitration, subordination, and compromise. As we had discussed earlier in this accommodation. Then improved care and treatment. If there is no conflict, every healthcare professional harmonious and work together, and performance will be increased, outcome become better in the hospitals. Look at this, healthcare professionals adjust with each other to attain the goal. The role of assimilation in hospital. Share knowledge and provide constructive feedback to colleagues. Then increase the socialization, the time of assimilation, learn with each other, they share the knowledge, then improve communication, then diagnosis, perfect assessment, identify the causes, identify the needs of the client, then better care and treatment, promote job performance, prevent stress, which is very important in the assimilation, then support to job satisfaction. Look at this, healthcare professionals share their experiences and assimilate with each other. Then importance of integration in hospital. Integration nothing but coordination. The coordination is very important to promote integration or between the departments, for example, nursing and allied health, medicine mainly, doctors, nurses and allied health should be coordinated. Within the nurses need to coordinate between the department, medical, surgical, child health, maternal health, etc. Then prevent role conflict. Then improve communication between department. Then accurate diagnosis. Identify the causes of disease and needs of the client. Then treatment, client-oriented treatment and formulate treatment plan. Share information regarding client between the healthcare professionals, between the department mainly. Look at this, work together, integrate every sections of the hospital. Then isolation, as we know that isolation is part of hospital, every hospital having separate ward, isolated ward. What is meant by isolation in hospital? This refers to measures taken to prevent infectious diseases from being spread from patient to other patient. Healthcare workers and visitors from others to particular patients. So key word is that prevent infectious diseases from one person to another person in the hospital. The isolation is a measure. Look at this, you can see that a doctor visit a client. Social distancing. First maintaining, then identify the reality of these patients and try to better care. The need of isolation in hospitals. Process of isolation is needed in hospital to prevent communicable diseases, nosocomial infections, which means hospital acquired infections, the complete separation from others or person suffering from infectious diseases, which may be called technical word is that quarantine. A particular period, a person, a patient should be separated. For example, COVID-19, this word nowadays using quarantine. to a particular day to prevent form of isolation, strict isolation, which means separate, totally separated. For example, separate room or the facilities, etc. Then contact isolation. Contact means touch. Then respiratory isolation. We have been nowadays using, the contact isolation is very, very important nowadays for prevent COVID-19 as well as respiratory isolation. We have been using mask. Then blood and body fluid precautions to prevent the diseases. Then reverse isolation. Reverse means yes. Then effects of isolation. Patient may not be able to receive visitors. They maybe feel lonely, we know that. Loneliness may be create the mental suffering and may cause the issues. Then patient may be anxious. Then children feel punishment. Then more time with patients. Then may not be able to receive certain type of care, due to these isolations. Then due to risk that other patient may be become contaminated. So this is the effects of isolation. So we need to think about the patients and how to improve the psychological support and social support to prevent this other complication. For example, maybe stress in the time of isolation. We are nursing professionals need to essential to provide this better care to isolate patients. The importance of social process in nursing. First is that the knowledge of social process is need to nursing for assessment. Nurse should be assess social process of individual patients. The individual patients having cooperation in the family social setting or not, or individual patient having any conflict, social conflict, So that assessment is help to this guide the patients. For example, many of the patients feeling stress due to conflict. They don't know about. They do not accept conflict. Any conflict arise in the life, they are suffer a lot. They don't know about how to resolve the conflict. What are the sources of conflict? So we are nursing professional. Now we know that. What is the conflict? What are the effects of conflict? What is the real source of conflict? So this knowledge very useful for us to guide the patients, to guide the client to improve the mainly nursing diagnosis. We can identify the real needs of the patients. Then care, client oriented care, the social process oriented. For example, if a person may be a lack of cooperation in the social setting, we need to advise. A patient having any conflict in the life, how to resolve it, advise to. Then cure. Students, these all the social process are medicine, social medicine. If a patient no cooperative process in the hospital, in their life, we need to advise improving the cooperation in workplace, in the families. If a person having conflict in the life, we are nurses educate and prescribe this medicine, conflict resolution. We can solve the stress from the patients as well as promote health. So this is a excellent medicine. There is no side effect. We can prescribe the patients. As well as we need to think about nowadays COVID-19. There is no medicine for the COVID-19. There is no vaccinations, which is medicine. isolation only medicine, which is a effective social medicine. We can prevent it by means of social distancing, hand hygiene. We can see that, different types of these isolations, strict isolation who are affected, then respiratory isolation, mainly contact isolation. If when you touch anybody, if you feel having any droplet infection, should be hand hygiene. So this isolation is an effective social medicine to prevent the diseases and promote the health. Now we have been experiencing. The nursing management, every types of nursing management, we need to use this knowledge, mainly this accommodation, conflict resolution, this management, mainly stress management, conflict management, etc. In the very setting, in educational setting, hospital setting, a community setting, etc. The nursing education, we need to educate the nursing students regarding the social process, need to assess the nursing students the process, they experiencing all the process or not. Some students may be so suffered, there anybody experiencing the conflict that I'm experiencing, we need to guide nurses, educate the student nurses. Then health education to the client regarding every social process and assess and diagnosis and client oriented health education. Then counseling, guide to patients, client oriented guidance. The nursing research, stress management, as we have discussed, then is applied to all the nursing disciplines, medical, surgical nursing, and child health nursing, maternal health, mental health, and community health nursing. So when you read these specialty books, these all the words we can see favorably. So we need to conceptualize, when you start the books, think about these, all the words are available or not. Then conclusion, thus concepts such as all the social process determine the health status of people. For example, over conflict, cause destruction and stress and cause the various mental illness and physical illness. So these all the social process or social medicine. We can create our life become happier by using this knowledge. Then apply to nursing in every aspect of nursing, care, cure, prevention, promotion, rehabilitation, etc. Then solve the social problems and promote sustainable peace and development in our society. Then important questions will be next class. Now discussing time, questioning time.
Yes, sir.
Yes, can you list what are the role of conflict in the hospital?
Help
One or two the role is enough.
prevent the role of conflict.
Yes, prevent the role conflict. Okay, prevent the role conflict, which means conflict between doctors and nurses and supervisor and subordinate. Yes, Gomad, it's enough. Thank you for your response. So, thank you everyone. Have a wonderful day. Enjoy the day. Thank you all.
Thank you, sir.
Yes.
Thank you, sir. Thank you, sir.
Okay. Okay.
Thank you, sir.
Yes.
Thank you, sir.
Yes.